Hi everyone, this is Dr. Sukesh Rao Sankineani, consultant in shoulder surgery, arthroscopy and joint replacement at Yashoda Hospitals, Secunderabad. I often come across patients who have what is called as irreparable cuff tear. Now what does that mean? Basically that means you have the cuff muscle that is in the shoulder which is retracted to such a significant way that it is not possible to repair it back into position. So these patients, if you leave them alone, end up having shoulder arthritis, and that will require an arthroplasty or a joint replacement surgery. So the treatment options for a irreparable cuff tear are two. One is tendon transfers. So we take muscles from other parts of the shoulder and instead of the rotator cuff muscle, we replace that muscle in that position. This is called as tendon transfer. We have one muscle in the front that is called as latissimus dorsi. When we have one muscle at the back that is called as lower trapezius. So we use both these muscles to reconstruct the cuff. Then you also have an option called as superior capsular reconstruction, wherein we take a sheath of muscle from the thigh and we place that sheath into the shoulder joint to replace the cuff muscle. Finally, in some patients, nothing helps. So in those patients, the option of reverse shoulder arthroplasty will help and will restore normal function.
Like, comment, and subscribe for more health updates.